Alright team, let's discuss the case. The patient presents with glomerulonephritis, primary sclerosing cholangitis, and tenosynovitis. What are your thoughts?
Glomerulonephritis indicates kidney inflammation, while primary sclerosing cholangitis affects the liver. Tenosynovitis is inflammation of the sheath surrounding a tendon. It seems like a complicated case.
Considering these symptoms, it could be a systemic issue or an autoimmune condition affecting multiple organs.
I agree. We need to consider the possibility of an underlying autoimmune disorder or a rare genetic condition.
Enough deliberating. The diagnosis is diabetes insipidus. We need to act fast. Prepare for coccygectomy.
Coccygectomy is a risky procedure. Are you sure it's necessary?
Damn it, Gary, I didn't spend years studying just for you to question my judgment. Trust me, coccygectomy is the only way to save this patient's life. Now get ready for surgery.
I'll assist in the procedure, but let's make sure all precautions are taken for this high-risk surgery.
Understood. Let's do everything we can to ensure the patient's safety during the coccygectomy.
That's what I like to hear. Let's save a life today, team. You wanted to see me, Tracy?
Yes, Hawks. I heard you want to perform coccygectomy on a patient you believe has diabetes insipidus. Where did you get such a ridiculous idea?
I read about it in a fashion magazine, Tracy. They said it could be a possible solution.
A fashion magazine? Hawks, we can't base medical procedures on fashion advice. We need solid medical evidence and research before even considering such drastic measures.
I thought it sounded innovative and worth exploring, Tracy.
Innovation is one thing, Hawks, but risking a patient's health based on fashion trends is another. Stick to evidence-based medicine, please.
Understood, Tracy. I'll reconsider my approach and look into more traditional treatment options.
Good. Let's focus on providing the best care for our patients using proven methods. Thank you, Hawks.
Thank you, Tracy. I'll make sure to do better next time. You could really use some of the advice I read in those same magazines.
What do we have here? Oh no, the patient is in critical condition. This is not good. I need to break the news to Hawks that the coccygectomy was not the correct treatment for diabetes insipidus. How do I even begin to explain this?
What in the world were you thinking? You nearly killed our patient with your incompetence. Wrong coccygectomy, wrong diagnosis. Are you even doctors or just a bunch of quacks?
I'm sorry, Hawks. We did our best to analyze the situation and make the right call.
I still think the issue was with the coccygectomy procedure, not the diagnosis itself.
No, Kelly, I believe the root of the problem was misinterpreting the initial symptoms. That's where we went wrong.
You are all imbeciles. See the simplest of medical cases right in front of your eyes? I don't even know why I'd bother with you lot. Figure it out yourselves. I'm done here. I can't believe I couldn't figure out what's wrong with the patient in room 203. It's driving me crazy.
Well, maybe you missed something obvious. Did you check their vitals properly?
Of course I did. And I even ran all the necessary tests. It's like a medical mystery.
Could it be a rare condition? Or maybe a medication interaction you didn't consider?
Wait a minute. I think I know what it is now. Thanks for the suggestions, Johnson.
No problem, Hawks. Just doing my job as the best colleague ever.
Hawks suddenly gets up. I've got to go take care of this. Thanks again, Johnson. Catch you later.
Wait, you're leaving already. What about finishing lunch together?
Hawks leaves abruptly without saying goodbye.
Well, I guess he's on a mission now. I'll just finish this sandwich alone then.
I've got it. Diabetes insipidus was wrong all along. It's hollow endemic.
Hawks, what are you doing storming in here without any proper medical equipment?
This is reckless. You can't just barge in here and make wild claims.
Hawks, you need to get your act together. We have a patient on the table here.
I'm telling you, the symptoms fit perfectly. Trust me on this one. I told you it was a rare condition, Tracy. If only you had listened to me from the beginning.
Listen, Hawks, we can't afford to make mistakes like that. The wrong diagnosis almost cost that patient their life.
But if you had just trusted my judgment, we wouldn't have been in this mess in the first place.
Your judgment was flawed this time, Hawks. You need to learn to trust the expertise of your colleagues.
I can't believe you're blaming me for this. You're the one who didn't want to consider all possibilities.